Hello, my name is Megan Shaver, and this is my presentation on Alzheimer's. For disease statistics, Alzheimer's disease is described as a neurodegenerative neurocognitive disorder associated with aging. Neurodegenerative means that there is a death of neurons, and a neurocognitive disorder is diagnosed when a patient experiences a decline in cognitive functioning. Alzheimer's is a brain disorder that slowly destroys memory and thinking skills and eventually the ability to carry out the simplest tasks. About 60 to 90% of dementia patients have Alzheimer's, but a definitive diagnosis requires an autopsy after death. It's the most common form of dementia and it worsens over time. About 7 million people are living with Alzheimer's in the United States, but it's estimated to total 13 million by 2050. Only about 10% of people with Alzheimer's are diagnosed before age 65, which is considered younger onset Alzheimer's, but about 1/3 of people 85 and older have Alzheimer's. In 2021, Alzheimer's was the 5th leading cause of death for people aged 65 and older. About 2/3 that are diagnosed with Alzheimer's are women, and older Black Americans are twice as likely to develop Alzheimer's or other dementias over whites. Older Hispanics are 1.5 times as likely to develop Alzheimer's or other dementias than whites. And on average, a person lives 4 to 8 years after their diagnosis, but with right care, they can live up to about 20 years after diagnosis. Alzheimer's usually first presents as difficulty remembering new information. As Alzheimer's advances through the brain, it leads to increasingly severe symptoms, including disorientation, mood and behavior changes, deepening confusion about events, time and place, unfounded suspicions about family, friends, and professional caregivers, and more serious memory loss and behavior changes, and difficulty speaking, swallowing, and walking. A person with Alzheimer's typically does not notice anything wrong. It is usually found by loved ones that know their normal behavior. Alzheimer's begins with the loss of cognitive functioning and behavioral abilities and increases to the point of interfering with daily life and activities. A probable Alzheimer's diagnosis is based on genetics or family history, learning and memory impairments, and a steady loss of cognitive function. A neurological exam is taken to rule out other issues that would cause memory loss, like a stroke, Parkinson's, tumors, or buildup of fluid in the brain. A doctor will also perform cognitive, functional, and behavioral tests to assess loss of function in the brain and later to track progression of Alzheimer's. Careful testing is done to diagnose Alzheimer's. It can include many tests, but typically someone with Alzheimer's will have changed levels of tau and beta amyloid in the cerebrospinal fluid. Alzheimer's disease is named after Dr. Alois Alzheimer. In 1901, Dr. Alzheimer first discovered changes in the brain tissue of a woman who died of an unusual illness who presented with memory loss, language problems, and unpredictable behavior. In 1906, Dr. Alzheimer described a peculiar disease that featured profound memory loss and microscopic brain changes in a meeting for psychiatrics. Through an autopsy, Dr. Alzheimer found abnormal clumps that are called amyloid plaques outside neurons and tangled bundles of fibers or neurofibrillary or tau tangles inside neurons, which are still the main features of Alzheimer's today. In Alzheimer's, misfolded forms of amyloid beta protein clump together in deposits that are called amyloid plaques. Tau proteins are also misfolded and appear in bundles called neurofibrillary tangles or tau tangles. Most people develop these plaques and tangles over time, but patients with Alzheimer's develop them at a higher rate and in a predictable pattern that usually start in the memory areas of the brain. It is believed that they block communication between nerve cells and disrupt cell processes, leading to the destruction and death of nerve cells that cause the symptoms of Alzheimer's to present. Currently, the costs for health and care for dementia patients are estimated to reach $360 billion in 2024, and it will estimate to go up to about $1 trillion in 2050. Alzheimer's currently does not have a cure, but there are 3 FDA-approved treatments that remove beta amyloid to reduce the cognitive and functional decline in people with early Alzheimer's. Aducanumab is being discontinued this year so that the people that make it can focus on other areas of research. Any other treatments aim at helping manage systems and temporarily delaying progression, as well as improving quality of life. Some treatments are only available in the beginning stages, so doctors first consider which stage you are in before recommending treatment, whether you're in the first stages of asymptomatic, mild cognitive impairment, early stage, which is considered mild, middle stage, which is considered moderate, or late stage, which is considered severe Alzheimer's. As Alzheimer's progresses, brain cells are permanently lost, so medications can only serve to delay loss and ease the symptoms. Loss of brain cells and functioning cannot be reversed. Since medications for Alzheimer's are newer, insurance does not always cover them. About 60% of U.S. healthcare workers believe that the healthcare system is not helping patients or their families navigate dementia care adequately. It is possible to get Alzheimer's through genetics or lifestyle or a combination of both, so taking preventative steps like managing chronic health issues, being physically active with good nutrition, avoiding alcohol and smoking, getting enough sleep and social interaction, and keeping the mind stimulated are ways to lower the risk of getting Alzheimer's. Cause versus correlation for certain risk factors are still unknown, but Alzheimer's can be linked with hearing loss, depression, mild cognitive impairment, or a concussion or major brain injury. As Alzheimer's progresses, basic functionality majorly decreases and leads to the inability to have conversations or respond to the environment. About 70% of dementia caretakers say that coordinating care for patients is stressful. 74% of dementia caretakers say that they struggle to maintain their own health because of their caretaking job. And then about 2/3 of dementia caretakers say that it is difficult to find resources and support for their needs. The role of a caretaker changes as the disease progresses, starting with just giving support in the early stages, and then as the disease progresses, they provide a greater level of behavioral and physical care, and then intensive care in all areas while focusing on quality of life and preserving dignity. These are my references. Thank you very much for listening.